your partner, and then you guys will switch. So let's talk about why we would do a patellar tendon unload. So someone with some early tendonitis, or what you would suspect as a tendinopathy is starting in there, right? So a fat pad irritation, those would be your main things. Somebody who's got this anterior knee pain that when they load, run, jump, land, they're having pain here. And so you want to try to eliminate that with some form of taping just to get them through their event, and then you'll end up doing the treatment or diagnostics, whatever you need to do to get what is happening here, and then start the rehab plan. So we would spray because we're going to assume they're going into play, okay? Or this could be somebody who you've seen in the clinic and you want them to leave, they're walking and going up their stairs in their house and stuff like that without this knee pain. You could do this tape to get them to home. The issue is then they're going to need to take it off at some point because they'll do their icing or their topical gels or Voltaren or Arnica or whatever you're going to part of your treatment plan. So this tape is not really ideal to keep on like a kinesio tape, okay? So we would have sprayed per leg. Again, with any sensitivities, we would use skin prep. So now what we have to think about is where does the cover roll go? So if the inferior pull to the tuberosity, that's where you kind of think where your attachment is, right, of your patellar tendon. So you know you have to cover that. So that means your cover roll needs to go below it and slightly above it. So something like that. So we end up not really covering the entire kneecap. You see that? So we've got this space right here. So now, I can measure, my anchors. Now the anchors are going to have a slight angle to them. They're not going to be straight up and down like the letter H, but they're also not going to connect like the letter V, okay? They're split here, they're spaced because again we want to approximate, and we're going to do it on this angle so that we can get up under the patella and kind of curve around it, giving it this little like sling to sit in, okay? So I'm gonna need my strips. So we'll do that like we've done, one down and one up, so that you don't pop the tape off of here. And then what you need to do here is you're gonna make strips that are kind of progressively longer, because you have to think it's going to be farther apart at the top edge, okay? So again, I keep my tape in my hand, a thumb anchors, I pinch and squeeze and lift, I pull up on the tape to lay down to anchor to the other side. So again, unlike the tibia, we're doing our unload now crisscross, crisscross, because we want to approximate the tissue. 50% on the one below, my hand should be on the other anchor, lift up and lay down, okay? 50% lift up. So it's not just I'm pulling, I'm lifting to approximate the tissue, then I'm kind of pulling across, okay? 50% on the one below. As I'm getting closer to that patella, you start to see we're getting that nice wrinkling. And I'm going to need one more strip, maybe two more, because now we want to kind of wrap around the patella. So I'm going to make one a little longer because I need to re-anchor. anyway. And then we're gonna go like 50%. Make that a teeny bit shorter so it doesn't touch her skin. Okay, but watch how we do this. I'm coming up now. I'm kind of wrapping around. Can you see that? I'm almost taking a little angle as I come up and around under her patella. And so I feel like we're done. We're right where we need to be. We've passed the tendon attachment. We've got the nice patella just sort of sitting up here. We've lifted it. And her fat pads are getting a little bit of an unload. And then we're going to go back in and re-anchor all of those strips down. Okay, now we're going to do a quick check. Can she bend the knee? I hold it to make sure nothing pops off, and then we're good to go, okay? Now the question here is, do we wrap this or not? If you've sprayed, and if you know it's hot and humid out, you might double spray, thinking the athlete's going to be like,